Hello, and thank you for trusting your care with Dr. Hall and the team here at OMS of Utah. We will be taking this time to go over some of the post-op instructions and the best way to care for your patient. When you arrived, you received our pamphlet with the post-operative instructions for you. We'll be going over those with you in this video. On the very top is our office phone number where you can get a hold of a surgical staff member or Dr. Hall. Unfortunately, every surgical procedure is paired with pain. So your patient will be given a prescription for ibuprofen 600 milligrams. They will take that once every 6 hours, along with over-the-counter extra strength Tylenol. It is expected that the worst discomfort will occur 2 to 4 days after surgery, so make sure to take the medications as instructed. Now, Dr. Hall may prescribe something stronger if needed, and we will go over that with you today. Dr. Hall will also prescribe an antimicrobial mouth rinse that your patient will begin use tomorrow and continue that for 1 whole week. Your patient will also experience swelling and bruising. We have provided an ice pack for you. Just throw it in the freezer and apply to the outside of the face. It's the most useful here in the next 48 hours. After surgery, bleeding is normal. Use gauze to apply gentle pressure over the surgical site. Your patient will leave our office with gauze in their mouth that should be changed out every 45 minutes to an hour. When your patient changes their gauze, they will fold it into thirds and roll it up. And at that point, they can place it over the surgical site to apply gentle pressure. Another useful tip is to keep your patient's head elevated with an extra pillow while they're sleeping or have them sleep in a recliner. For your patient's comfort, they will want to eat cool, soft foods for the first 24 hours. This includes ice cream, jello, pudding, and smoothies. Avoid ones with seeds so they don't get caught in the extraction sites. This evening, if your patient can feel their lip, cheek, and tongue, they can advance their diet to more room temperature foods such as mashed potatoes, scrambled eggs, and soup. Hot foods tend to increase the patient's oozing and bleeding. The day after surgery, your patient may return to brushing their teeth, but being cautious of those back surgical sites area, as there may be some stitches in place that will dissolve and fall out on their own anywhere from 3 to 10 days. If you have been given this irrigating syringe in your recovery bag, you will begin use of that in 1 week. Your patient will fill the syringe with warm salt water and place the tip into the extraction site to help clean. Do this 3 to 4 times a day for 2 weeks and lessen as the surgical sites heal. You will join your patient in our recovery area after surgery. We'd be happy to answer any additional questions you have at that time. We do not allow video or recording in office for the patient's safety, our staff safety, and HIPAA privacy.